we now check out the opiates and the opioids. So before we dive into this, we need to look at some terminology first. What's the difference between an opiate and an opioid? We'll first start off with the opiates. These will consist of three different agents. It'll be opium, morphine, and codeine. These are all going to be derived from the poppy plant. So all of our opiates will be poppy plant derivatives, and that'll include our opium, the morphine, and the codeine. Now we look at the opioids. Our opioids are going to be things that stimulate the opioid receptor. So it includes a whole bunch of things. It also includes the opiates, so it includes opiates plus methadone, heroin, for example. So it's going to include things that stimulate this opioid receptor, but also it's going to include our opiates as well. So the opiates stimulate this receptor, but to be classified as an opiate, you have to be derived from the poppy plant. Heroin or black tar, whatever you want to call it, is not derived from the poppy plant per se. It's going to stimulate that receptor, though. So that's the difference between terminology here. So our opioids are all going to stimulate that opioid receptor. Now, we can dive into intoxication because both of them do the same side effects. When ingested, they will produce the same profile, and that includes decreased GI motility, so you'll get constipation, you'll get a euphoric state, the pinpoint pupils. That's going to be the layman's term for meiosis. Meiosis is the fancy way to say it. Otherwise, pinpoint pupils could be a buzzword. Meiosis could be a buzzword. If the question says a patient comes into the emergency room, their eyes are pinpoint pupils, but they appear intoxicated. Well, that really kind of rules everything out. You can say, oh, it's either an opioid intoxication or an opiate intoxication. Either one. They're not going to tell you. They're not going to give you both of those options. It'll be one or the other. So pinpoint pupils, if you see meiosis during intoxication, I want you to immediately think, is it an opioid intoxication? You also can see some respiratory depression because it is a CNS depressant. You'll also get some slurred speech. How do you treat an intoxication of an opioid? Well, what you'll do is you can give naloxone. It's actually going to be given in the ambulance sometimes before they even come in, but you can also give naltrexone. Both of these are going to block that opioid receptor, so that way the opioid is not going to be binding, causing that euphoric state. Instead, we've got our drugs to antagonize that receptor. Now, the withdrawal of an opioid. I put quotation marks because, surprise, we see autonomic instability. All right, kind of becoming a recurring theme. We'll see mydriasis. Well, okay, that's an interesting one. A lot of the other drugs that we've covered have, during their intoxication state, they have dilated eyes. However, for opioids, it's going to be opposite. During their intoxicated state, they'll have these pinpoint pupils, the meiosis. During the withdrawal state, they'll have these nice dilated pupils, so you'll get the dilated mydriasis. You'll also see rhinorrhea, lacrimation, so kind of a wet picture going on. We'll have some nausea, vomiting, diarrhea, kind of building into our wet picture. We'll also see some chills and overall muscle spasms or muscle aches, kind of hurts, their body just aches, trouble sleeping, and a bad mood. So that's some of the signs of dope withdrawal or dope sickness as they call it. You should be able to pick withdrawal and intoxication of opioids because that is a favorite on the boards. Now, how are you going to treat a withdrawal of an opioid? Well, looking at our autonomic instability, we can offer clonidine. What is clonidine? That's an alpha-2 agonist. And alpha 2 agonists are going to kind of decrease our sympathetic outflow. So we're going to try and regulate some of that autonomic instability. You can also give methadone, which is going to be an opioid, because remember, methadone fit under the opioid receptor. So it's going to stimulate the opioid receptor, so you have to be careful for methadone that they don't go from being hooked on heroin to now being hooked on methadone. So it's kind of a which is worse type deal. If I had to be hooked to one, I'd rather be hooked to methadone. However, really it's not a win-win situation. So really you want to go through the withdrawal phase. The withdrawal phase lasts for a couple days, up to 5 days, maybe a week. You'll get all these terrible symptoms. You feel like death. For the most part, you don't get the risk of fatality with withdrawal, kind of like you would with a benzo or alcohol withdrawal. It's a lot safer, but a very unpleasant feeling. So withdrawal of heroin, for example, not fun.